Heart failure is the fastest growing type of heart disease in the country. A new case every minute of every day. For about half of those patients, there are no effective treatments.
CBS 2's Dr. Max Gomez reports on a new device being tested that may offer new hope for millions of patients.
Whenever you're ready, sorry.
A 6-minute walk test in the halls of a hospital tells doctors a lot about the condition of Janet Wickham's heart. Janet lost her mother and great-grandmother to diastolic heart failure and assumed that by the time she was at risk, there'd be some new treatment options. Unfortunately, there aren't.
I'm 69. You know, what's happening? All this, I've been... What's out there? What's new? But there hasn't been anything.
Diastolic heart failure means Janet's heart pumps fine but doesn't relax enough to fill up completely between beats, which causes blood to back up and build pressure in her lungs.
This is when the patients start having shortness of breath. Other than diuretics, we don't have any way of dealing with the patient's symptoms.
But a new approach could change that. At the Ohio State University Wexner Medical Center, Janet became the first patient in the U.S. to possibly test this new dime-size implant. During a heart catheterization, doctors punch a small hole in the wall of a patient's heart and use this shunt to keep the hole open, so excess blood can drain from one side to the other.
It's just like when you have a traffic jam, instead of backing up all the way back to the lung, you create kind of a detour that's going to take you around the lung.
That should relieve pressure and allow the heart to work better. During this first ever randomized trial, enrolled patients will undergo a catheterization. Half will get the device, the other half won't. Patients and their doctors won't know until the trial is complete who got it. Janet doesn't know if she did, but is happy doctors are testing new options her family never had.
I'm wanting to feel better. And what will be, but if there's a chance of something new, I want to try it.
There have been small studies with the device in Europe which showed promising results, but this is the first trial to actually assign patients randomly to either get the device or a sham procedure. Dr. Max Gomez, CBS 2 News.
Now we're told the device will be tested in a total of 40 patients at up to 28 different hospitals worldwide.